Okay, we're going to talk about the water, and it's not as universal as we need it to be. So, um, okay, the problem of water scarcity affects a large part of the population, and the World Health Organization estimates that 80% of all the illnesses of the world in development are caused by the lack of clean water and basic sanitation. The right of drinking water and sanitation is part of the human right, officially recognized by different international organizations, and the United Nations has this right in the center of its Sustainable Development Goals agenda. A new culture of sustainable development should be developed because if we think that the forest is not just a storehouse of wood, our rivers and lakes and wetlands are such much more than just stores of water. And we must understand that them are social, cultural, and environmental values.
Well, the purpose of this presentation is for the audience to understand the situation of and to empathize with the marginalized groups described in the next sections. As well as this work seeks to show that there are forgotten people for whom the state must take responsibility, thousands of women, men, and children who suffer from the lack of clean water. The discrimination that these people suffer is often unknown by the rest of the population and even by the state. This presentation has been organized into 7 sections. The first sections describe the importance of water related to people's health and the actions carried out by the United Nations over the years to achieve universal access to drinking water. After this, the discussion moves on to the role of water for governments, showing that even today, water is not considered a human right for the state. The next section defines water in the framework of equality, social or economic, which is often not considered. The section that follows describes socially marginalized groups in relation to the supply of the resource and how they are affected due to the lack of a human resource. After that, this topic is discussed from the point of view of the Sustainable Development Goals, highlighting its role as a promoter of the compliance with human rights, emphasizing equality. The next section identifies disadvantaged groups within a city, and finally, the last section discusses the legislative frameworks and how they affect the application of human rights principles.
Okay, according to the parameters of the WHO and the United Nations Children's Emergency Fund, a reasonable supply of water should be at least 20 liters per person per day, and the installations must be located less than 1 kilometer from the user's home. And just 4% of the population live 60 kilometers or less from the coast. And this problem of contaminated water and poor sanitation are linked to transmission of diseases such as cholera, diarrhea, dysentery, hepatitis, typhoid, and polio, and affects many areas of life, but the most affected is health.
This is particularly the case in healthcare facilities where both patients and staff are placed at additional risk of infection and diseases when water, sanitation, and hygiene services are lacking. The availability of safe and sufficient water supplies is related to how wastewater is managed. About 1.5 million people, million children are estimated to die each year from diarrhea as a result of unsafe drinking water, sanitation, and hygiene. However, diarrhea is largely preventable, and the deaths of children could be avoided each year if these risk factors were addressed. Where water is not readily available, people may decide that hand washing is not a priority, thereby adding to the likelihood of diarrhea and other diseases.
The response of the United Nations. SDG target number 6 calls for universal and equitable access to safe water. It means drinking water from an improved source that is located on premises, available when people need it, and free from fecal and chemical contamination. From 2000 to 2015, the United Nations carried out the International Decade for Action Water for Life and the Millennium Development Goals almost at the same time. And these programs were focused on the achieving universal access to clean water.
With these programs, the countries working together and the UN as a bridge, the following advances were made. From 1990 to 2015, 2.1 billion people gained access to a latrine, flush toilet, and other improved sanitation facilities, helping to comprise 68% of the global population. In December 2016, the United Nations General Assembly adopted the resolution International Decade 2018-2028 for Action Water for Sustainable Development to help put a greater focus on water during 10 years. Failing to respond effectively to this problem will have devastating global effects.
Okay, water, right, or commodity, it's all a discussion. And access to clean water can promote or delay human development. If a person is healthy and strong, it could develop their full potential. And drinking water and sanitation have been recognized as a human right since 2010 by the United Nations General Assembly, and this is also true for food and health.
Based on what is stated above, for people and societies, access to clean water is essential to individual and collective progress, and is key to reducing mortality and health costs. In addition to deaths, diseases occur. Over 160 million people suffer from stomatitis. 500 million people are infected by trachoma, and 6 million suffer from visual impairment.
Also, we must and we should end gender inequalities, because in many homes around the world, women have responsibility that men does not. and women have to walk kilometers to collect water, reducing their possibility to study or work, and that really affects their independence.
Equality and non-discrimination are the bedrock principles of all human rights and are linked in human rights law. States must ensure that individuals and groups do not suffer from discrimination and that they can enjoy full equality. Article 1 and 2 of the Universal Declaration of Human Rights states that all human beings are born free and equal in dignity and rights, and that everyone is entitled to all the rights and freedoms set forth in this declaration without distinction of any kind. The International Covenant on Economic, Social, and Cultural Rights specifies that the rights set out in the treaty are to be realized without discrimination of any kind as to race, sex, language, political or other opinion, national or social origin, property, birth, or other status.
And by law, discrimination is defined as any exclusion or restriction that prevents people from the exercising of their human rights and their fundamental freedoms.
There are inequalities in access to water and sanitation across the world and within countries. Discrimination based on gender, age, or disability tends to exist in all countries. Ethnic, religious, and caste discrimination may also exist, but they will be expressed differently depending on the context. This section highlights some of the most common forms of discrimination in access to water and sanitation. The first one is indigenous origin. In some countries, indigenous origin who living in certain areas may not have the same access to water and sanitation services as the majority population.
The second one is sex and gender. And in many societies, women and girls are responsible for their domestic use and for keeping the home clean and also for the collect of water. And they also have to leave the house to use a latrine or a toilet. And menstruation remains a taboo subject in many parts of the world. And girls and women miss school days and work during their periods due to a lack of adequate sanitation.
Disability and health. According to the World Health Organization, over 1 billion people worldwide live with a physical, mental, intellectual, or sensory impairment. And despite the fact that all these people should receive all the possible support, many water and sanitation services are not accessible to people with disabilities. States must therefore work with disability groups on policies that will address these causes of inequalities.
People living in slums and homeless people are often not taken into account in urban planning, and they are basically absent from official records, and states are required to take measures to ensure these people an access to water and basic sanitation.
Imprisonment. The human right to water and sanitation applies equally to the prisoners and people living in detention centers, but these rights to water and sanitation are violated through the provision of substandard facilities.
And others. And when we say others, it's because there are a lot of prejudices and causes of discrimination, and we can't count them all. And often the right of water is denied just for having a different opinion or a different political ideology of according to your sexual identity or your sexual orientation. And it's a big group of people which is discriminated in their own homes and every day, and it's very difficult to monitor these people because it's in their own homes.
The 2015 adoption of the Sustainable Development Goals by the UN General Assembly marked a significant change in how the global community understands social and economic development. The SDG demands that everyone benefit from social and economic development without exception. Principles such as equality, participation, access to information and sustainability embedded in the Sustainable Development Goals are also human rights principles.
There can be no exceptions within universal. It's hard to assume that it's not going to happen for 2030, but at least without additional efforts to reduce inequalities. But obviously, universal access to clean water and sanitation, it's a very high bar, and because today any country can truly claim universal access to water and sanitation, so we can't expect all the world to have it.
Universal access doesn't only include access at the household level, but also at work, educational and healthcare institutions, public institutions, including detention centers and public places such as transport hubs and marketplaces. People must not only have access to services outside the home, but must be able to use them as well. Water and sanitation are necessary for the realization of many other rights, such as health, food, education, work, housing, and urban development.
Investment in water and sanitation will always bring benefits in terms of education, health, work, and addressing poverty, and these have an enormous impact in the economy of the whole country.
The identification of disadvantaged groups present a major challenge for UN states members, which all have agreed to leave no one behind. through the SDGs and through the adoption of the resolution recognizing the human rights to water and sanitation. The challenge partly relates to generating data and evidence to differentiate disadvantaged groups from the wider population. The first disparity is rural-urban. There are rural-urban disparities in many counts of inequality, including access to water and sanitation.
And the second one is intra-urban, and with this we mean between formal and informal settlements, because often slums have high density population, and this has a more negative impact even than the rural areas because of the quantity of people. And the third one is group-related inequalities, and we already talked about these groups in the previous section. And each country should identify this group and work with them and monitor progress in access to clean water. And the last one is intra-household inequalities, and we also talked about these people which is discriminated in their own house, in their own homes, because in some cultures exist an status in the house, and it's whether women, older people, children, people with disabilities, and these cases are terrible because it's more difficult to identify and to monitor, and that this group should be considered by the state.
Legislative and regulatory frameworks, budgetary priorities, policies and planning, as well as specific national or local circumstances such as corruption or levels of democracy, can affect the application of the human rights principles. These frameworks can create obstacles to eliminating inequalities in access to water and sanitation.
For example,
legislative frameworks should establish the principles of non-discrimination and equality at the highest possible level, preferably in the Constitution.
For example, laws that criminalize open defecation and urination discriminate people who don't have a toilet or people who are living in the streets. So that laws can only be effective if the state ensures access to sanitation services, and policies, strategies, and plans can play a specific role in the achieving of equality.
Services must be universal, and solutions that guarantee their access have to provide to everyone, including people living in informal areas and remote rural areas. Service providers must be transparent, act in good faith, and be efficient and effective.
So it's a fact that water and basic sanitation and lack of it causes more deaths than any war. And despite all this data, today water is still considered as a commodity subjected to the laws of market and not as a fundamental need. And having water shouldn't be a privilege, as we always said. And we must demand from government drinking water in every corner of every country, because it is an obligation and a priority.
Our research shows how far we are from meeting the Sustainable Development Goals. Although progress has been made, it is insufficient, and we must reverse the numbers from here on.
And that was all.